Phenylketonuria, PKU, screening in newborns, an essential step for ensuring lifelong health. Welcoming a newborn into the world is a joyous occasion filled with hopes and dreams for a healthy and happy future. While your baby may appear perfect, certain hidden conditions, like phenylketonuria, PKU, can impact their well-being, particularly their developing brain. Significance of PKU testing. The PKU test holds immense significance in the early identification of a potentially debilitating genetic disorder that may not manifest visible symptoms in newborns. Despite outward appearances of good health, the internal metabolic processes can be affected, making the test a crucial component of comprehensive newborn screenings. Understanding phenylketonuria, PKU. PKU, a rare genetic disorder, disrupts the normal metabolic process of breaking down phenylalanine, an essential amino acid found in protein. Amino acids play a pivotal role in regulating crucial metabolic functions within the human body. When a newborn has PKU, their body lacks the ability to produce an enzyme necessary for phenylalanine metabolism. As a result, phenylalanine accumulates in the bloodstream, potentially causing harm to the developing brain and cognitive functions. Importance of amino acid regulation. Amino acids, including phenylalanine, serve as building blocks for proteins and play key roles in various physiological functions. The delicate balance of these amino acids is vital for the proper development and functioning of the body. Any disruption, as seen in PKU, where phenylalanine accumulates unchecked, can have adverse effects on neurological development. Comprehensive newborn screenings. The PKU test is seamlessly integrated into the broader framework of comprehensive newborn screenings conducted for every infant born in the United States. These screenings go beyond the visible health indicators and delve into the genetic and metabolic aspects that might not be apparent at first glance. By including PKU testing in this routine, healthcare professionals can identify conditions that, if left undetected, could lead to long-term complications. Early detection for timely intervention. The value of PKU testing lies in its ability to provide early detection of the disorder, enabling healthcare providers to initiate timely interventions. Early intervention is paramount in preventing the harmful consequences associated with elevated phenylalanine levels, such as developmental delays and cognitive impairments. Global impact of newborn screening. Beyond the borders of the United States, many countries recognize the importance of newborn screenings in ensuring the well-being of the next generation. As part of global healthcare initiatives, the integration of PKU testing reflects a commitment to proactive healthcare practices that address potential health challenges at their earliest stages. Testing procedure for phenylketonuria, PKU. The process of conducting a PKU test is a meticulous and essential step in ensuring the early detection of this genetic disorder. The thoroughness of the procedure, conducted by healthcare professionals, is critical for accurate results that guide subsequent interventions. Timing of testing. The PKU test is typically administered by a healthcare professional no sooner than 24 hours after the baby's birth. This specific time frame allows for a sufficient window to detect potential abnormalities in phenylalanine levels. Post-hospital births. In cases where the birth occurs outside a hospital setting, parents are strongly advised to schedule a prompt visit to a healthcare provider within the first few days after birth. This visit is essential for conducting the necessary screenings, including the PKU test. Blood sample collection. The blood sample, crucial for determining phenylalanine levels, is commonly extracted from the newborn's heel. This procedure is conducted with a gentle prick to minimize discomfort for the infant. The heel is a preferred site for blood collection due to its accessibility and the presence of capillaries close to the surface. Specialized paper collection. Once the blood sample is obtained, it is carefully applied to a specialized filter paper designed for preserving and transporting biological samples. This paper serves as a crucial medium for maintaining the integrity of the blood sample during transit to the laboratory. Laboratory analysis. The filter paper, with the blood sample securely affixed, is sent to a laboratory equipped to perform the necessary analyses. In the laboratory, technicians employ precise methods to measure the phenylalanine concentration in the blood sample. This quantitative assessment is pivotal in determining whether the levels fall within the normal range or if further investigation is warranted. Communication of results. Following the laboratory analysis, the results of the PKU test are communicated to the parents by the baby's healthcare provider. This step is crucial in facilitating open and transparent communication between healthcare professionals and parents, ensuring a clear understanding of the test outcomes. Counseling and guidance. In the event of elevated phenylalanine levels or other concerns identified through the PKU test, Healthcare professionals offer counseling and guidance to parents. This may include discussions about the implications of the results, the potential need for additional testing, and the initiation of early interventions, such as dietary management. Interpreting results. The PKU test primarily measures the level of Phe in the baby's blood. A normal Phe level is typically less than 2 mg per deciliter, mg/dl, while levels exceeding 4 mg/dl are considered high. However, it's crucial to note that even if the results fall outside this range, it doesn't conclusively indicate PKU. Further tests may be required to confirm or rule out the presence of the condition. False positives may occur in premature babies, where the enzyme responsible for breaking down Phe might not have fully developed. Conversely, false negatives may result from factors such as inadequate feeding, vomiting, or the timing of the test concerning the baby's birth. Significance of the test. Timely diagnosis and intervention for PKU are paramount, as untreated cases can lead to lasting issues, including developmental delays, lower IQ, mood disorders, hyperactivity, and severe intellectual disability. Symptoms of phenylketonuria, PKU. While phenylketonuria, PKU, may not present obvious physical symptoms in newborns, the underlying metabolic dysfunction can have profound consequences on the child's health and development if left untreated. Understanding the subtle signs and potential long-term effects of PKU is essential for prompt diagnosis and intervention. Neurological symptoms. Developmental delays. Children with untreated PKU may exhibit delays in reaching developmental milestones, such as crawling, walking, and speech. Lower IQ. Elevated phenylalanine levels can impact cognitive function, leading to a lower intelligence quotient, IQ, compared to peers without PKU. Learning difficulties. Impaired cognitive function may result in challenges with learning and academic achievement. Behavioral and psychiatric symptoms. Mood disorders. Elevated Phe levels can contribute to mood disorders, including anxiety and depression, affecting the child's emotional well-being. Hyperactivity. Some individuals with PKU may display hyperactive behavior, making it challenging for them to focus and engage in structured activities. Physical symptoms. Fair skin and hair. Children with PKU often have fair skin and hair due to the impact of elevated Phe levels on melanin production. Eczema. Skin conditions, such as eczema, may occur in individuals with PKU. Gastrointestinal issues. Vomiting. Infants with PKU may experience vomiting, particularly if they consume protein-rich foods that contribute to elevated Phe levels. Musty odor. Odor in urine and sweat. A distinct musty or mousy odor in urine and sweat is a characteristic sign of untreated PKU. This odor results from the accumulation of phenylalanine byproducts. Dental issues. Enamel hypoplasia. PKU can contribute to enamel hypoplasia, leading to dental problems such as weakened tooth enamel. It's crucial to note that the severity and manifestation of symptoms can vary among individuals with PKU. Some may exhibit mild symptoms, while others may experience more pronounced effects. Early detection through newborn screening allows for timely intervention, mitigating the impact of elevated phenylalanine levels on the developing brain and overall health. Treatment, primarily through a carefully controlled diet low in phenylalanine, aims to prevent the progression of symptoms and support normal development. Regular monitoring and adherence to dietary restrictions are essential components of managing PKU. To ensure individuals affected by this rare genetic condition lead healthy and fulfilling lives. Risk signs of phenylketonuria, PKU. Identifying potential risk signs of phenylketonuria, PKU, is crucial for early detection and intervention. While newborn screening plays a pivotal role in identifying elevated phenylalanine levels, certain factors may indicate a higher risk for PKU. Awareness of these risk signs can prompt healthcare professionals to conduct thorough assessments, ensuring timely diagnosis and management. Family history. Genetic predisposition. PKU is an inherited genetic disorder. If there is a family history of PKU or other metabolic disorders, there may be an increased risk for the condition. Ethnic background. Prevalence in certain populations. PKU is more prevalent in certain ethnic groups, including individuals of Northern European, Irish, and Native American descent. Understanding the ethnic background can help assess the likelihood of PKU. Consanguinity. Close relatives with PKU. Consanguinity, or the marriage of close relatives, increases the risk of genetic disorders. If parents are closely related and have a history of PKU, there may be an elevated risk for the condition in their offspring. Maternal PKU. Untreated PKU in pregnant women, women with PKU who become pregnant and do not manage their condition. appropriately are at risk of passing elevated phenylalanine levels to the developing fetus. This can lead to intellectual disabilities and developmental issues in the child. Abnormal newborn screening results. Elevated Phe levels in newborn screening. High phenylalanine levels detected during routine newborn screening indicate a potential risk of PKU. Further diagnostic testing is necessary to confirm the diagnosis. Symptoms in siblings. Developmental delays or behavioral issues in siblings. If there are siblings with developmental delays, lower IQ, or behavioral problems, it may raise suspicion of a genetic disorder like PKU. Premature birth. Prematurity. Premature infants may exhibit elevated phenylalanine levels, leading to potential false positives in PKU screening. However, this does not rule out the need for further evaluation. Inadequate feeding during newborn screening. Insufficient breastfeeding or formula feeding during testing. If the newborn is not adequately feeding during the PKU screening, it may result in a false negative result. Ensuring proper feeding practices during testing is essential for accurate results. Treatment. While PKU has no cure, effective management involves implementing a special, lifelong diet low in Phe. Initiating this diet as soon as possible, ideally within a week or 10 days of birth, is crucial. The diet typically involves a Phe-free infant formula, with the potential inclusion of some breast milk. A dietitian specializing in PKU can create a tailored eating plan to ensure optimal growth and development. Children with PKU often need precise portions of fruits, vegetables, and low-protein cereals, bread, and pasta. Foods high in Phe, such as dairy, eggs, meat, poultry, fish, nuts, beans, and items with the artificial sweetener aspartame, are typically restricted. Due to the limited diet, a special formula containing protein, minus Phe, and other essential nutrients is recommended. Regular blood tests and medical checkups are essential to monitor the effectiveness of the dietary plan. In some cases, medications like sapopterin, Kuvan, may be prescribed, especially for those with milder forms of PKU. This medication provides a bit more flexibility in the diet while maintaining control over Phe levels. For adults with uncontrolled high PKU concentrations, the medication pegvaliase PQPZ, Palynziq, can be considered to help reduce levels, emphasizing that managing PKU is a lifelong process. Frequently asked questions, FAQ, about phenylketonuria, PKU, testing and management. What is phenylketonuria, PKU? PKU is a rare genetic disorder that affects the body's ability to metabolize phenylalanine, an essential amino acid found in protein. If untreated, elevated phenylalanine levels can lead to adverse effects on the developing brain and cognitive functions. Why is PKU testing important for newborns? PKU testing is crucial for the early identification of the disorder, as symptoms may not be immediately visible. Timely detection allows for interventions that can prevent lasting issues, including developmental delays and lower IQ. When is the PKU test conducted for newborns? The PKU test is typically conducted by a healthcare professional no earlier than 24 hours after the baby's birth. It is an integral part of comprehensive newborn screenings conducted in the United States. What does the PKU test measure? The PKU test measures the level of phenylalanine, Phe, in the baby's blood. Elevated Phe levels can indicate the presence of PKU or the need for further diagnostic testing. What are normal and high levels of Phe in the test results? A normal Phe level is typically less than 2 mg per deciliter, mg/dl, while levels exceeding 4 mg/dl are considered high. However, elevated levels do not conclusively indicate PKU, and further testing may be required. Can false results occur in PKU testing? Yes, false results can occur. Premature babies may have false positives due to the underdeveloped enzyme responsible for breaking down Phe. False negatives can result from factors such as inadequate feeding, vomiting, or the timing of the test concerning the baby's birth. How is the PKU test performed? The test involves a healthcare professional taking a blood sample from the newborn's heel through a gentle prick. The blood is applied to a specialized filter paper and sent to a laboratory for analysis. What happens if PKU is detected? If PKU is detected, healthcare providers offer counseling and guidance to parents. Treatment involves a lifelong, carefully controlled diet low in Phe, with regular monitoring through blood tests and medical checkups. Can PKU be cured? Currently, there is no cure for PKU. However, effective management, primarily through dietary restrictions, can prevent the progression of symptoms and support normal development. Are there medications for PKU? In some cases, medications like sapopterin, Kuvan, may be prescribed, providing more dietary flexibility while maintaining control over Phe levels. For uncontrolled high PKU concentrations in adults, pegvaliase PQPZ, Palynziq, may be considered. Conclusion. In summary, PKU screening is a crucial part of newborn care, enabling early identification and intervention for a genetic disorder that may not show immediate symptoms. By disrupting the metabolism of phenylalanine, PKU can impact cognitive development. The screening, seamlessly integrated into routine newborn tests, allows for global proactive healthcare. The meticulous testing procedure, from timing to laboratory analysis, ensures accurate results for timely interventions. Open communication and counseling for parents contribute to effective management. Recognizing risk signs, interpreting results, and understanding treatment options underscore the importance of comprehensive care. In conclusion, PKU testing plays a pivotal role in preventing long-term complications, highlighting its significance in ensuring a healthy start for every newborn. Your health matters. Quali.Health